Welcome to the Duke PA Program Preceptor Development video on an overview of the PA profession and the Duke PA Program curriculum. This brief session will describe the role of the physician assistant in the current healthcare system, the history of the Duke PA Program, and an overview of the Duke PA Program curriculum. PAs are licensed professionals who practice medicine in collaboration with physicians and the larger healthcare team. They exercise autonomy in medical decision-making, providing a broad range of diagnostic and therapeutic services. They also practice in educational, research, and administrative activities. PAs practice medicine, and all entry-level education programs are preparing PA students to do just that, including assessing patients with history and physical exam, ordering and interpreting diagnostic studies, determining treatment plans including pharmacologic and behavioral interventions, conducting procedures in both inpatient and outpatient settings, assisting in surgical procedures, writing prescriptions, and providing patient education and counseling. PAs improve health and the health system by increasing access to care, reducing healthcare costs, providing coordination and continuity of care, being involved with preventive health and wellness programs, managing the health of populations, as well as reducing hospital readmission and infection rates. The first PA program in the United States was at Duke University. It was a concept developed by Eugene Stead, MD, with the first class graduating in 1967. Since that time, the Duke PA program has been a long-standing leader in PA education with over 175 students, a large team of faculty and staff, as well as a health services research program. The education program has also been the recipient of multiple education grants. The Duke Physician Assistant Program's mission is to educate caring, competent primary care physician assistants who practice evidence-based medicine, are leaders in the profession, dedicated to their communities, culturally sensitive, and devoted to the positive transformation of the healthcare system. Duke PA students earn a Master of Health Sciences degree after a 24-month education program that includes a 12-month didactic phase and a 12-month clinical phase. There are several prerequisites to admission, including having an undergraduate degree, 8 prerequisite courses including anatomy, physiology, and microbiology, patient care experience of at least 6 months but averages closer to 2 years, as well as completing the GREs. Common areas of patient care experience prior to PA school include nurse assistants, medical assistants, EMTs, medical scribes, and clinical research coordinators. The didactic phase of the programs consists of several courses that span the 12-month preclinical phase. Those courses are listed here. The didactic phase curriculum involves a variety of instructional strategies, from reading to classroom and small group activities, as well as simulated patient encounters, early clinic-based encounters, multiple reflective activities, as well as hands-on learning in laboratory and dissection anatomy lab settings. Evaluation methods are similarly robust and regular to ensure students acquire the skills needed for the clinical phase of education. During the didactic phase of training, the students acquire proficiency in the following skills to ensure they are ready to apply that foundation of knowledge during the clinical phase of education. The clinical phase of education lasts approximately 12 months in duration, beginning with a bridge to patient care course, followed by 10 rotations with at least one of those rotations being in an underserved area. Students also return to the program regularly for written and practical examinations on callback days. Students have a non-clinical course called Evidence-Based Practice 2 and conclude the year with a summative course called Senior Seminar. The clinical experiences during the clinical phase consist of 7 required rotations and 2 elective clinical courses, as well as the non-clinical course Evidence-Based Practice 2. A majority of the courses are 4 weeks in duration, except for internal medicine and primary care, which are 8 weeks in duration. The clinical education of Duke PA students takes place in a variety of clinical settings and communities throughout North Carolina, the United States, and often the world. Approximately 50% of clinical placements are within the Duke Health System, with many placements occurring in regional health systems, private practices, health departments, as well as with the VA. Students participate in learning in urban, suburban, and rural settings to ensure that they have great breadth and depth to their experience during their training. During the clinical phase of training, students continue to acquire proficiency in a variety of essential clinical skills to help ensure that they are prepared for clinical practice as new providers who are licensed by the State Medical Board. The Duke PA program continues to achieve its mission to educate caring, competent healthcare providers. Our alumni and new graduates work in a variety of healthcare settings and many practice in underserved areas, while program faculty continue to contribute to educational, clinical, and health services research. The Duke PA program and its students extend sincere thanks to our dedicated clinical preceptors who contribute so much to the education of Duke PA students. Please contact us if you need additional information or have questions. And for additional preceptor development resources and videos, visit the following website.